What you got?
Welcome to the regular meeting of the Public Health and Safety Committee for July 30th, 2025. I am Jason Chavez, the chair of this committee. Before we begin the meeting, I want to offer a friendly reminder to all members, staff, and the public that these meetings are broadcast live to enable greater public participation. These broadcasts include real-time captioning as a further method to increase the accessibility of our proceedings to the community. Therefore, all speakers need to be mindful of the rate of their speech so that our captioners can fully capture and transcribe all comments for the broadcast. We ask all speakers to moderate the speed and clarity of their comments. At this time, I'll ask the clerk to call the roll so we can verify the presence of a quorum.
Councilmember Payne.
Present.
Rainville.
Present.
Ellison is absent. Palmasano.
Present.
Vice Chair Wansley is absent. Chair Chavez.
Present.
We have 4 present.
Let the record reflect that we have a quorum. We'll start with the consent agenda, which are items 2 through 5 on the agenda. Item number 2 is authorizing a grant acceptance from the Minnesota Department of Health for a public health response sustainability grant to support local response to emergencies. Item number 3 is approving an appointment to the Public Health Advisory Committee. Item number 4 is authorizing a memorandum of understanding with Augsburg University and the Aurora Center for a DOJ grant funding project for prevention and intervention of sexual assault, domestic violence, stalking, and human trafficking. Item number 5 is setting a public hearing for August 13, 2025 to consider an ordinance amendment related to the license fee schedule, specifically adding fees related to city-owned resources. Colleagues, are there any discussions on any of these items? All right. I'll move approval of items 2 through 5. Are there all those in favor? Say aye.
Aye.
Those opposed, say nay. Any abstentions? That carries, and the consent agenda is approved. I want to acknowledge that Councilmember Ellison is with us. Councilmember Ellison, would you like to vote on the consent agenda? Yeah. Clerks, if you can please, without objection, mark Councilmember Ellison's votes 2 through 5 in the affirmative. Next up, we will take up our public hearing item. This amendment is related to the workplace regulations aligning city and state law with regard to sick and safe time and updating its enforcement provisions. I'll invite staff to provide a brief overview of the change before our public hearing. I will now invite staff to come up.
Good afternoon, Chair Chavez, members of the committee. My name is Brian Walsh. I am Associate Director of Civil Rights in charge of Labor Standards Enforcement. I'm here today to walk through, just at a high level, some of the proposed amendments to our sick and safe time ordinance. The vast majority of those I would characterize as technical staff-led amendments aligning city ordinance with state law, with one notable exception not found in state law. It is an enforcement-related provision that is about training. It's noted at the end of the presentation. I'll probably defer questions about that piece, if there are any, to the author, Councilmember Pomano, but I'm also very happy to help if I can. Before I get into substantive differences between city and state law, just give some brief context of how we got here and why amend the ordinance now. Sick and safe time functions like a floor, not a ceiling, sort of like a minimum wage, except it requires a minimum amount of paid access to paid leave for all employees for all sick and safe time covered purposes. There are 20 states across the country and even more cities and counties that have similar paid sick leave laws, including the cities of St. Paul and Bloomington. Here in the Midwest, Minneapolis led the way in 2016. The very first Earned Sick and Safe Time or Sick and Safe Time law was passed, effective in 2017. All of this matters because nationally, over half of all part-time workers have no access to any paid leave of any kind. A little bit more than 1 in 5 full-time workers as well. And we know, we all know that working while sick is bad for workers, but not only bad for workers, bad for business, bad for families, bad for communities. If we didn't already know that, the coronavirus pandemic really crystallized that for everyone. Several years after the city led the way with our ordinance, the state of Minnesota passed an earn sick and save time law covering everyone statewide, of course, including in the city of Minneapolis. It very much copies the framework of our city ordinance in the state law. However, there are some small but significant changes that expanded and strengthened protections for workers. So why would we amend the ordinance now? It's an opportunity to strengthen protections for workers in our city ordinance. Aligning it with state law would also reduce complexity and confusion for both employers and employees trying to navigate the differences between the two, and we would effectively be removing what are now obsolete provisions in the city ordinance where the state law expanded protections and raised the bar higher than city ordinance in those places. We would also be empowering our civil rights department to enforce the law. So now I'll get into, just at a high level, some of the substantive differences currently between state law and city ordinance. Perhaps the single biggest one is that all employers under state law are covered by the Earn Sick and Save Time statute. Under city ordinance, there was an exception for micro-employers with six or fewer employees that must provide sick and save time, but it did not necessarily have to be paid. That provision is now obsolete. Everyone is covered under the state law, and all employees are covered regardless of size. There's a clarification in state law that says all employees eligible if anticipated to work at least 80 hours in a year. That's a helpful just clarification about the meaning of that provision. The state law expands the definition of family member to include the concept of one's chosen family. I think that's a more inclusive definition. There is no change in state law about the minimum amount of accrual, so the amount that an employee is entitled to is exactly the same currently under city ordinance and state law. Under state law, however, employers may choose to front load 48 hours in a year and then pay out at the end of the year any unused time, which then avoids carryover of unused time into subsequent years. We've heard anecdotally from both employers and employees that they appreciate often that flexibility. Under state law, if an employee is rehired within 180 days by the same employer, any previously accrued sick and save time must be reinstated. Currently, under city ordinance, that number is 90 days. Expanded protected uses of sick and save time under the state law, and now includes bereavement, exposure to a communicable disease, which was in response, I think, to the coronavirus pandemic, and closure of an employee's place of business due to weather. Currently, under city ordinance, coverage includes closure of a family member's place of care, but it does not include place of business. So, for example, if an employee is scheduled to work, the workplace closed, maybe a snowstorm or something like that, that worker would be able to call in sick. There are some important clarifications in the state law about minimum increments of use. Depending upon an employer's payroll system, employees can often use in increments of 15 minutes, and employers are not allowed to require increments larger than 4 hours. So, for example, if an employee has a doctor's appointment or something like that, they may be able to come back to work and don't necessarily have to call out for and use sick and save time for the entire day. Under city ordinance, currently a brand new hire must wait 90 days before using any accrued sick and save time. That requirement is eliminated under the state law. There are also clarifications about what documentation may be required by employers of their employees, including that a written statement from an employee is acceptable under certain circumstances. All of that clarification is really, really helpful. We get a lot of questions from both employers and employees about that particular provision. Under state law, accrual balances must be provided to employees, but they may be provided in an online system, not necessarily on pay stubs themselves. That's a helpful clarification and a slight distinction from current city ordinance. Employers must provide, under state law, the terms of use of their paid sick leave policy, and all PTO provided above and beyond the accrual requirements in the law must also comply with other protections that we've noted here, and record keeping, et cetera. Under state law, point systems, absence control systems, for example, if regardless of reason for absence, sometimes there are systems where employees get a point, and then once they have accumulated a certain number of points, they might be subject to discipline. Accrual of those points in those sorts of systems are explicitly prohibited in the state law. It's a helpful clarification and difference from city ordinance. And that brings me to the final provision. This is not currently in state law, but it is about training. And again, Councilmember Palasios can speak more about this one. But it explains or states that if, in the event of an investigation, an employer found to be in violation, the department may require a training of the employer or its employees regarding rights and responsibilities under the ordinance. So with that, it concludes my presentation of just sort of the overview at a high level. I'm now happy to stand for your questions.
Thank you. First, I'll pass it to Councilmember Pomano.
Thank you, Mr. Chair. I wanted just to opine a bit on Mr. Walsh's points and then go into a little bit more detail about the singular change and departure from the state law. At its core, this ordinance brings our city safe and sick time rules together with state law. And what it does by us keeping them in here is to empower our whole labor standards division to enforce them to the full extent of the state law. Although many of these changes were small, there were a massive amount of them. It took a lot of time for city staff to get us to this point. We first passed safe and sick time in 2016 to be implemented in 2017. So we were the first in the state to do it, and I am the last author standing, the last city council author still here from that original 2016 ordinance. Since that time, the state had largely copied and pasted our ordinance and made it state law beginning of last year, which was a huge win. But there were several ways, as outlined by Brian Walsh, where the state law went a little further, a little broader than our local ordinance. And that led us to a couple of big problems. One, that employers were trying to navigate and educate employees about two slightly different sets of regulations. This meant two information posters at the work site and some general confusion about how to follow both sets of these rules. Our Labor Standards Enforcement Division can only enforce up to our ordinance, not state law. So this led to times when our enforcement division would have to say, sorry, we can see that your employer violated your rights, but that's state law and we can't do anything about it, so you'll have to file a claim at the state. No one wants to hear that. No one wants to give that. And the average person, frankly, shouldn't need to understand the difference. The differences seem minor, but it could mean everything about being eligible or not and to be there for a loved one. So the changes in this ordinance give our enforcement staff full authority to enforce the law on the same set of broader state rules. And this is a big win for workers. The other big change that Mr. Walsh alluded to in this proposed ordinance centers on our ability to require paid worker rights training from employers who have been found to be in violation of our ordinance. This could be for employers who violate once or who are well-known violators. Right now, this type of training is ordered by the director or their staff as the result of a negotiated settlement. But the big difference is that now we would have the ability right off the bat to not have to negotiate that. But to be able to require worker rights training proactively after a violation is found, not just when the employer agrees to it. So I think that both allows our enforcement team to right size that kind of a consequence for the employer and worker. Not all situations are created equally. Not all employers are the same. And I think this is huge. To our knowledge, no one else in the state is doing this, and we are really leading the way by codifying this into our ordinance. So thank you for your consideration today.
Thank you. With that, I will now open the public hearing. And for the public, I want to let you know that if you did not sign up to speak, to provide your testimony, and you wish to provide testimony today, please come over here and sign up next to our clerks. Write down your name. That way we can make sure that you have the opportunity to speak before the council. Each speaker will have 2 minutes to provide testimony. With that, our first speaker is Hannah. Hannah Zinn. Welcome.
Good afternoon, Chair Chavez and members of the Public Health and Safety Committee. My name is Hannah Zinn, and I am the Director of Government Relations for Hospitality Minnesota. We represent the state's restaurants, hotels, and lodging industries. Thank you for the opportunity to speak about the proposed Earn Sick and Safe Time ordinance. Businesses are struggling to keep up with new employer mandates that have passed in the last few years. By bringing the city code into compliance with state law, business owners will have greater transparency to what is required of them at the state and local level. Many businesses have commented on the disjointed nature of having a state law in conflict with a local ordinance. By creating continuity between these two levels of government, employers will have an easier time complying with the law. While we appreciate the city's move toward conformity in the law, we express extreme concern with codifying employer-paid training. Employer-paid training is often used as a remedy in administrative policy, but it is not codified anywhere else in city code. This major step to codify employer-paid training opens the door to other opportunities for this kind of overreach into private business. We respectfully ask you to reconsider the training portion of the remedies section and look forward to working with you all to make this ordinance one that works for employers and employees in Minneapolis. Thank you.
Thank you. And as a reminder, if you wish to testify, please sign up with our clerks. Next up, we have Maria Palasios. Hola.
Buenas tardes a todos ustedes. Yo soy María Palacios, tengo 2 trabajos en la ciudad de Minneapolis, en restaurante. Yo soy madre soltera y abuela de un niño. Pues he tenido que llevarlo a veces al doctor y no supe de las horas de enfermedad pagadas hasta que conocí a los miembros de CETUL. Con mi trabajo nunca me habían pagado, no me quisieron pagar los días de enfermedad que yo pedía porque había llevado a mi niño al doctor. Y eso hace como 3 años que yo supe desde los beneficios que tenemos de los días pagados de enfermedad. Y por esa misma razón, yo no estoy de acuerdo en que no se tome la enmienda que incluyan los entrenamientos de los trabajadores para ser informados de sus derechos. Para mí es importante que incluyan ahora los entrenamientos pagados para los trabajadores, que sean informados ellos de sus derechos y que se cumplan las leyes, porque han estado violando todas esas leyes, porque a ninguno de los trabajadores les pagan las horas de enfermedad, al menos de que lleven un certificado médico. En mi trabajo yo tenía también PTO, pero nunca me pagaron los días de enfermedad. Sí. Aquí en el CETUL me informaron de esos días y también nos dieron un entrenamiento y yo estuve muy feliz cuando en mi trabajo fueron a dar ese entrenamiento. Y por eso les agradezco y les pediría de favor que sí tomaran la enmienda eso de pagar los entrenamientos pagados para los trabajadores, porque es muy importante, como para ustedes es muy importante sus derechos de ustedes, también nosotros los trabajadores. Muchísimas gracias y espero que sí nos tomen en cuenta.
My name is Maria Palasios. I have 2 jobs in Minneapolis in restaurants. I'm a single mother, and I'm also a grandmother of a small child. And sometimes I have to take my grandson to his doctor's appointments. I didn't know about paid sick time until Setul informed me about our rights, and that wasn't until about 3 years ago. At my job, we have PTO, but honestly, I don't know of many times or ever that people get paid for paid sick time because they want us to bring in a doctor's note. We weren't told what that meant, and when I or my grandson got sick, they didn't pay us. They didn't pay me for those sick time hours. I don't agree with the amendment that doesn't include a paid training so that workers are informed about their rights. For me, it's important that 1 hour of paid training is included, not just when a violation happens, but that we as workers can be informed of our rights. When I wasn't paid for sick time, I had to make a complaint, and even so, it's still difficult for bosses to comply with the law. And that's why I feel like it's very important that we are given these trainings before violations occur so that we don't always have to be going to ask for our rights. When my workplace had to give us a training on our rights and paid sick time, I was really happy because a lot of my coworkers didn't even know about sick and safe time and how to use it. I've learned a lot about training from Setul and in that hour of training we had. And I really hope that this can get passed, that you listen to us. We deserve our rights just like y'all. And it would really mean a lot for workers to have this right and right to paid training. Thank you so much.
Muchas gracias. Next up, we have Jake Dunzy. Welcome.
Hey. Hi, my name is Jake. I live in Ward 7. I'm here to tell you I don't support the paid training language in this amendment and ask that you follow the recommendations of the Workplace Advisory Committee for a strong training component that gives workers the right to receive training from a trusted community partner before their rights are violated. I work in restaurants, an industry high in violations that often go unreported, whether it's because workers are too intimidated by their superiors or don't know where to report them, or lots of times it's because they're entirely unaware of the rights afforded to them. I remember an incident where a coworker was ill, he was nauseous with a head cold and was unfit to leave the house. So he tried to call out of work and take the day off to recover, but since we were short-staffed that day, his supervisor demanded he have a doctor's note if he wanted the day off. There was an implication that his job was in jeopardy if he stayed home, so obviously he didn't. When he came in, it was clear he shouldn't be there, and shortly got sent home anyway. Regardless, his illness soon spread around to the rest of the staff, and who knows who else. The story's not a unique one in the restaurant industry, even nearly a decade after the earned sick and safe time was passed at the city level. I'm asking you to support proactive trainings so that people that handle your food and drinks have the tools to keep ourselves and you safe and healthy. Thank you.
Thanks for being here. Next up, we have Estella Tado. Hola.
Buenas tardes, mi nombre es Estella Tado. Soy miembro de Setul, trabajo en el downtown de Minneapolis en un restaurante. Y por lo cual que estoy aquí es porque yo quiero que la enmienda incluya horas de entrenamientos pagados, porque en el año 2022 yo pasé por un robo de salario, que me pagaban menos del mínimo y apenas podía sobrevivir con mi familia, y ahora más que tengo mis 2 niños, entonces me gustaría que sean incluidas horas pagadas, esa hora de enmiendas, porque no estoy de acuerdo en una enmienda que no incluya el entrenamiento pagado, Me hubiera gustado saber que mis derechos antes de tener que poner una queja es mejor estar informados antes de esperar que pasen violaciones en el trabajo. A veces pasan, bueno, yo que he pasado humillaciones y a veces se sigue pasando por falta de información, porque muchos trabajadores no saben y compañeros que quisiera que ellos también sepan. Y por favor incluir entrenamientos pagados en la enmienda para que otros trabajadores no pasen por lo mismo. Gracias por escucharme. Yo como madre estoy dispuesta a luchar lo más que pueda por nuestros derechos, como trabajadores, como personas y como madre que soy también de mis hijos, porque a veces mi niña ahora que tengo, a veces se enferma y no me pagan esas horas de que yo voy con mi niña al hospital, o a veces me toca cuidar en casa, entonces de esas horas a mí no me pagan. Entonces para mí si no trabajo es una pérdida. Gracias por escucharme.
Hello, my name is Estella Tado. I'm a member of Setul and I work at a restaurant in downtown. I'm here today because I want the amendment to include 1 hour of paid training. Because in 2022, I experienced wage theft. I was paid less than the minimum wage, and it was difficult. My family, we were barely making it, and it was hard to survive that, especially with having my 2 kids. It was difficult. And that is a reason why workers everywhere should be able to know their rights and not just when a violation is happening. I can't be in agreement with an amendment that doesn't include this kind of paid training, because I would have liked to have known my rights before having to make a complaint. It is better to be informed than have to wait until a violation happens. You know, I think about my coworkers and other workers who don't really know about this law and also don't feel like they can take that time and get paid for it. I want the paid training to be included because I don't want other people to have to go through what I had to go through. And I'm willing to fight to make sure that our rights are respected and do what I have to do in that reason, because as a mom, it's really important to me. I have kids and I need to make sure that I can be with them. My young daughter, she gets sick sometimes and I have to either take her to the hospital or stay home with her, and I'm not getting paid for that time, and that's really difficult. It's a loss for me when I don't get paid for the time that I'm missing from work. And so I really want to encourage y'all to consider this amendment that includes an hour of paid training for workers, and thank you so much for listening to me today.
Gracias por su historia. Next up, we have Sue Goodstar.
Hello, I'm Sue. I live in Minneapolis in Jason's ward. I've been part of the co-enforcement program here forever, trying to educate the community. ESST is not a privilege but a right, and we need to work with people to make sure they get it. Let's build a program that's working. We've done many ESST trainings and trained actual companies that weren't providing sick time. From this firsthand experience, I can say that they're not being paid as well as my son and my sister. We need ESST amendment that is strong training policy that is proactive. This means that the training doesn't only happen when there's a violation and includes workers being paid for 1 hour of training. If the council is going to take time to amend this city law, we need to do it right. We have the opportunity to do something bigger than just make basic changes, especially when it's been 10 years since it first passed. Minneapolis has many people who still don't know about the right or their access to it. Through my conversations with workers, there's a handful of reasons why people may not have access. Maybe they're not being told of this. Maybe it's not being presented to them in their first language. Maybe that's fear of retaliation if they use sick time. And maybe they don't believe that their employers will pay them for the sick time. This is a tool to prevent violations, not to react when a violation happens. We shouldn't have to wait until our wages are stolen or sick time is denied when it's our basic human right. Council should take time to work with the community partners so this law is strong. We don't need to pass it quickly. Why? It's been enforced a year and a half ago and we still haven't gotten it right. So let's get it right. I have firsthand experience by participating in trainings with workers and seeing how much they didn't know and how this has affected them because they weren't informed of their rights.
Thank you, Sue.
A key part of this success is workers training workers. This is
Thanks, Sue.
effective on
We
how we're
appreciate
able to reach
the public
people
testimony.
because they share with others. This has to be a greater impact.
Thank you, Sue.
Period.
And for folks, you can always send your public comment to our email. If clerks, can you remind me the email that folks can send emails for public testimony as well?
They can send it to, it's listed at the end of the agenda as well, if you have a copy of the agenda. But you can email cityclerk@minneapolismn.gov. So.
Thank you. And folks can always send that, and we always get those emails as well. Next up, we have Ashton.
Hello, my name is Ashton. I'm from Ward 13 and I work in a restaurant downtown. We do not support the language in this amendment because it does not reflect the recommendation from the Workplace Advisory Committee, which includes proactive training for industries with high labor violations such as the restaurant industry, so workers don't have to wait for the rights to be violated before workers are able to understand the rights. If we are to keep the language as written, there's no telling how many rights will be violated before these trainings are able to take place and for workers to understand their basic rights. Thank you so much for your time.
Thank you. Next up, we have Carlos Ramos.
Hello, everyone. My name is Carlos Ramos, and I work in the city of Minneapolis with an organization named Rock, Minnesota. So our mission is to fight for justice and dignity of workers that work in the restaurant industry, many of whom are immigrants, people of color, low-wage earners, your constituents. Over the past 2 months, I have been collecting surveys with restaurant workers across the city to better understand the issues they face on the job, what needs aren't being met, and what rights are being violated. And one of the issues that comes up the most is earned sick and safe time. It's no surprise that so many workers are being denied this right, even though ESST has been law in Minneapolis since 2017, and even though the city was required to follow stronger provisions in 2024 after the state law came into effect. I continue to meet workers who have never even heard of it. I meet workers who don't know they have the right to take a sick day, to take care of a family member, or to recover from violence. All legally protected reasons to use ESST. What's worse is I visit restaurants where no one has explained rights to their staff. There's no training, no conversations, no awareness, and if workers don't know their rights, how can they use them? That's why I do not support the current language for paid training in this amendment. It does not reflect recommendations from the Workplace Advisory Committee. A strong policy includes proactive training, especially in industries that see higher violation rates. This training should be done by trusted community organizations and include proactive outreach, a way for workers to request trainings before violation happens, not after. This is a tool to prevent violations, not just to respond to them. Workers deserve more than just rights on paper. They deserve tools to use them. The council should work with community organizations to get this right, not just rush through it with only one sentence about trainings after a violation has occurred. Thank you for listening.
Thank you. Next up, we have Sed Muhammad. Welcome.
Hey, good afternoon, Chavez and councilor members. Good to see you guys again. I'm an Uber and Lyft drivers. Understanding our rights is something that is so important for everyone. We see what happens in our work as a driver every day when people do not understand their rights. We cannot support this proposal at this time. Paid and training is real important so that it is really important for us. We do hope that you slow down this process so that we can ensure that it's a balanced process. Thank you.
Thank you. Next up, we have Steen Berguson.
Good afternoon. My name is Christine Berguson. I go by Steen, and I use they, them pronouns. I currently live in Ward 10, and I've made my living and most of my friends working in the service industry. I've served some of you on this council before. Currently, I work in the North Loop, and I do not support the paid training language in this amendment. The current language does not reflect the recommendations of the Workplace Advisory Committee. This policy needs to be accessible for it to be effective. This amendment must include a clear process for workers to request a training at any time. We cannot wait until after a violation has occurred. Some workers may not even realize their rights were violated because they were never informed or educated on their basic rights in the first place. In connection with SATUL, I truly found out yesterday that we can use earned sick and safe time for our mental health needs, and I get misgendered nearly every day at work by guests and some coworkers, which takes a toll on my well-being. Some days I don't want to plaster a smile on my face and deal with reminding people my pronouns. I have been written up many times for receiving negative reviews saying, seems like she's having a bad day, and had I known that I could take a day off for a session with my therapist, maybe I wouldn't have been fired over those negative reviews from guests who truly have no idea what I'm going through. I want this policy to work for restaurant workers for whom it was written in the first place. If the language can be corrected and the trainings are completed by worker-centered, trusted community organizations, and it can be implemented so workers are aware that they're happening, I think my life and the lives of my friends would be greatly improved. We shouldn't have to wait until our wages are stolen or our sick time is denied to get basic information about our workplace rights. Thank you so much.
Thank you, Steen. Next up, we have Artemis Swanson.
All right. Good afternoon. My name is Caroline Dahl, and I'm here with SATUL. I'm a resident with Ward 10 and a 20-year Minneapolis restaurant industry veteran, here to read a statement from SATUL member Artemis Swanson, who was unable to be here today. Sorry. Hello, my name is Artemis. I live in Ward 2, and I am a hospitality worker in Uptown. As someone with a background in both general retail and hospitality work, as well as in retail management, I believe it is crucial to emphasize the importance that awareness of workers' rights has had on my ability to work in this city. As an employee, I would not have been able to access necessary medical care or take necessary time off if I had not known the rights I had to sick time and mandated breaks. Retail and hospitality are industries which seem to thrive off neglecting employees' needs in order to maximize store and service coverage, creating an environment where employees are worried whether taking necessary time off will lead to negative performance reviews, being passed over for promotions, or even terminated. In the 2 times I worked as a store manager, I was expected to go so far as to time bathroom breaks, police employee sick time, and generally be hypervigilant of minor violations of company time policy at the expense of my employees. It hurt the cohesion we needed to work effectively, caused me immense stress, and slowly pushed away really talented workers for minor accessibility needs. Retail and hospitality are already high violation industries, and the burnout employees experience due to these rights being ignored or stonewalled by management creates an unsustainable situation for all involved. My experience with the ways companies will squeeze every second out of low-wage workers has made it clear to me the need for mass awareness of employment rights. In service of this awareness, I urge the body to oppose the ESST amendment as currently written and adopt the strong training language recommended by the Workplace Advisory Committee, which ensures the right of workers to paid trainings before a violation occurs, so that workers like me are able to have the solid backing of knowledge necessary to advocate for themselves without risking financial stability. Thank you.
Thank you. Next up, we have Kathy, and I want to remind the public to please sign up if you haven't, if you wish to testify, because after the next 2 speakers, we will close the public hearing. So, Kathy.
Kathy's not here yet from work. Could we come back to her?
Do we have O'Brien, Elliot? I think I saw Brian here. Yep.
Hello, members of the committee. My name is Brian Elliot. I'm the Executive Director for the Service Employees International Union, Minnesota State Council. I live in Ward 11, and I serve on the Workplace Advisory Committee and served on the Workplace Partnership Regulations Work Group, which was the predecessor to the WAC that worked on the city's Earn Sick and Save Time ordinance initially. I am also the lead advocate at both the city and state levels on Earn Sick and Save Time, and can tell you I'm very, very familiar with every single word that was selected for both the city ordinance and the state law. I will start by saying that it is very important that the city come into compliance with the state law. In the years between the city ordinance and the state law passing, we learned a lot of lessons, both in the state and around the country, that were incorporated into the state's law. Unfortunately, there are a few pieces that are missing from the state's law in this ordinance. The ordinance does reflect the sections of state law in Chapter 181, so that's 181.9445 through 181.9448. It unfortunately misses pieces of Earn Sick and Save Time that are included in Chapter 177.50, including protections from retaliation for, or protections from retaliation by an employer threatening to report someone's immigration status or their family's immigration status. That is missing from this. In addition, the joint employer liability is also missing from this. That is in that section of law. The last thing that I will say is that all of these laws are only as important as the enforcement, and without the knowledge of the law,
Thanks, Brian.
These ordinances are worth no more than the paper they're written on.
Thank you, Brian.
Thank you.
And then next up, the last person that has signed up, unless others, sign up, is Kathy. Hi, Taylor.
Unfortunately, Kathy just got out of work and she's on her way here. Kind of heartbreaking, but I'm going to read her testimony that she prepared, and maybe she'll walk in and she can do it in Spanish in her 2 minutes. But good afternoon. My name is Catalina and I work downtown Minneapolis in food service. I am a single mother, a mom and a dad, a housewife, and at the same time, a woman who needs to work. It has been difficult for me. In 2021, one of my children went through a bout of depression, and I was forced to take on all 3 roles that I mentioned, as I couldn't let my children down or fail at work. This led me to fall into extreme stress, to the point of neglecting my younger children and focusing on my other child and work. If I had known about paid sick time, everything could have been very different, which is why I believe it is necessary for the amendment to include paid training, so that many mothers do not have to go through what I went through in 2021 and 2022, which were very difficult years in my life. I learned a lot about my rights and paid sick time thanks to Setul and Herania, an organizer at Setul, who invited me to participate in the rights trainings. I do not support the amendment if it does not include paid training for all workers, so we can be informed on the front end and not on the back end when we have to suffer through the consequences of our rights being violated. This is very necessary for us as workers. Thank you so much.
Thank you. I will now, I want to make sure no one signed up, correct?
We have no more people signed up.
Thank you. I will now close the public hearing and open up the speakers component for our colleagues. I'll first pass it to Councilmember Pomana.
Thank you, Mr. Chair. I would like to make a motion to move this forward without recommendation today, and to speak a little bit about the testimony that I've heard, not just here today, but throughout the course of this kind of project. We have really good partners for co-enforcement. Some of them are here in this room today, and they know their capacity for additional training for workers and how that might come about. We also know that 311 is sought after for safe and sick time details. We know that our health inspectors distribute and bring cards, Know Your Rights cards, through their regular inspections in the food and restaurant industry. I respectfully request that we move forward with this ordinance as updated and get our aligned language and enforcement pieces moving, and then address other additions separately. I don't think we should delay or postpone this part of the work that has taken 2 years to get done. As you can see, there is some interest in strengthening the training component. The details of that will take a little longer to work out. Workers shouldn't have to wait to make our laws as strong as the state's laws. There are people that fall through the gaps and through the cracks of the difference between our city and state ordinance. We do need workers and employers to both get on the same page. These changes help us to do that. I really appreciate these personal testimonies here today. And I believe a simple provision requiring all Minneapolis employers to do paid training for everybody would be considered penalizing employers who already follow the rules and aren't violators. It's going to need to be more sophisticated than that. And some of the things that we have talked about and discussed are about sector-specific training, like for the restaurant industry, for example. But it would need to be narrowly tailored to data that clearly shows consistent violations. So I'm not sure how we would take testimonies of the food and restaurant industry and say mandate that a company like U.S. Bank across the street require mandatory training for all of their thousands of employees. That doesn't make a lot of sense. Sector-specific training might make sense. And I also believe it would take the city or our partners years to scale up to the level of training that would be needed to provide that type of training. I'm not currently aware of any amendment or language that's been brought forward that our attorneys could even opine on that would address these types of implementation questions for training, but I can remain open to them. In regards to Mr. Elliott's point about components of the state law that might be missing, I would ask our city attorney's office, and Mr. Kane is right here in the audience, to take a look at that and make sure that we're absolutely consistent moving forward, because I know that that's a personal value and something that is close to everybody here on this council. So I will move this forward without recommendation for right now to allow a little bit of extra time.
Respectfully, quit taking a knee for business.
Thank you. I will be supporting the motion to move this forward without recommendation, but I will say, at least for the public, I do know that some colleagues are thinking about bringing some potential changes when they talk to the city attorney's office on amendments on this particular ordinance. I will say that I would be supportive of returning this item from full council back to committee if those amendments aren't drafted in time or the city attorneys do not have enough time to review those potential amendments. So for today, I will be supporting this motion to move forward to full council, but I do want to state for the public record that I am also in favor of sending this back to committee from full council if that work isn't being finalized by full council. I think that hearing the public testimony here today was really important to hear from workers in particular, making sure that we take a more preventative approach rather than once you violate someone's worker protections or rights, then you do that training. I believe that our workplaces should be providing that training beforehand because that is the best way to get out of ahead of potential workplace violations. And I just want to say thank you to the community members that came out and came to testify today. These are conversations that I hear not just here at City Hall, but out in community when you're talking to workers, particularly workers of color or immigrant workers, workers who are getting paid low wages in our city. So I just want to thank the public, and yeah, so I support that motion today, Councilmember Pomano, and I'll next pass it to Councilmember Ellison.
Thank you, and I'll support the motion as well. I both, know Councilmember Palmasano to be really diligent in how you pursue policy, but also know that we've got we've got real questions in the community, and I think some colleagues who aren't on the committee have some ideas about how to answer those questions. So I'll make sure that I'm following up, doing my due diligence before this comes to committee of the whole. And I do want to thank the community for the testimony. It's critically important that we're able to hear directly from folks about their experiences out at work, and for the folks at Sed who do this work, their experiences out in the field, right? And I wanted to see, I'm usually can be a stickler for our rules here, but it does look like one of the workers who missed their chance to advocate for themselves during the public hearing is now here. And I would invite us to see if there's no objection, if we could suspend the rules to allow her 2 minutes, even though the public hearing is now closed.
Without objection, the attorneys will entertain us. Will we open the public hearing to make sure that the individual that wasn't able to speak can speak today? Is that motion correct?
I'll defer to the clerk on the language of the motion, but I think that's permissible, Mr. Chair.
Thank you. We will reopen the public hearing. Thank you, Councilmember Ellison.
Hola, buenas tardes. Mi nombre es Catalina, trabajo en el centro de Minneapolis, en el servicio de comida. Soy madre soltera, ser mamá y papá de la casa a la vez es muy difícil. La necesidad de trabajar ha sido difícil para mí. Le voy a poner unas cosas aquí porque en el 2021 fue como una pausa para mí. Uno de mis hijos pensé que ya lo había superado. Tuvo depresión. Lo tuve de psicólogo en psicólogo, internado varias veces. 2021-2022 fue para mí como si fuera una pausa porque me dediqué a él, a llevarlo a los hospitales, trabajar. De mis niños más pequeños prácticamente los hice a un lado. Esos 2 años yo entré un estrés porque tenía que ocuparme de mi hijo, el que tenía el problema, del trabajo, de mis hijos más pequeños. Si les dediqué tiempo es 1%. Es muy difícil tomar esos 3 roles que mencioné, pues no podía quedar mal con ninguno de los 3. En el trabajo, el mamá, y todo lo que implica. Eso me llevó también a mí a exigirme más de lo que yo podía. Me enfoqué en mi trabajo y en mi hijo para sacarlo adelante. Si yo hubiera sabido que tenían horas de enfermedad, yo me hubiera quedado con mis hijos. El estrés que yo agarré no me hubiera sentido como yo me sentí, porque tenía que trabajar, tenía que cuidar a los hijos y me sentía que no estaba dando lo suficiente en la casa, en el trabajo. Me esforzaba con mis hijos también. Cuando yo me enteré que había horas pagadas de enfermedad, yo por Gerania me enteré y pues creo que sería importante que aprobaran los entrenamientos en el trabajo por esa razón, porque es mucho el estrés que yo viví para que yo no quiera que otras mujeres en la misma situación pasen por lo mismo. He aprendido mucho sobre mis derechos de las horas de enfermedad pagados gracias a Centul y a Gerania, que me invitó a participar en los entrenamientos, y yo apoyo la enmienda. Si no incluye los entrenamientos pagados, es muy necesario para nosotros los trabajadores que sepamos todo eso. Gracias. Estoy un poco nerviosa.
Muchas gracias por compartir su historia. Y gracias por su tiempo. Okay, thank you. All right, colleagues. On the motion to, Council President Payne, sorry.
Oh, I was just seconding that motion and was going to share, first, thank you all for sharing your testimony. I was going to share a story from one of my constituents who happens to work in the service industry and be bilingual and pretty in tune with his rights, and he witnessed his coworkers' rights being violated, and he proactively reached out to the Civil Rights Department and was able to work to get some relief for his coworkers, and there was a really good outcome. But we shouldn't be dependent on the luck of having a coworker who happens to know their rights. We should have every worker having an opportunity to know those rights, and I think that this conversation is really elevating that, and that's why I support this motion to forward without recommendation and see if we can have time to actually figure out how to bake that into the language here.
Thank you. Seeing no further questions or comments on the motion to move this item without recommendation to a full council, all those in favor say aye. Aye. Those opposed say nay. Any abstentions? And that motion is going on to the full council meeting. Our next item is an update, and thank you to everyone that was here today, community members, city staff that presented, and all the work that is going on to this. Our next item is an update on the City Trees Program in 2025. I'll now invite Sydney, the manager of the City Trees Program in the Health Department, to get us started. Welcome.
All right. Hi, everyone. My name is Sydney Schaff. I am the City Trees Manager in the Health Department, and today I am here to present an annual report on the City Trees Program. So a lot has changed in the last year. We are now a team of 5 as of the last couple months, which has been absolutely transformational for this program. And that includes 2 project coordinators, a tree outreach coordinator, and a community forester who's a certified arborist. So today I have an update on where we are at with our current numbers for the different planting programs that we have, an update on what we're doing for education, engagement, and outreach to recruit more participants for those programs, how the tree preservation ordinance work is going, and then an update on the condemned tree assistance program. So just as a quick recap, these are our 3 main planting programs that we offer. The residential City Trees program, City Tree Sale, is our largest program. This is an opportunity for residents to get low-cost trees for $30 each. This is a pretty significant discount if they were to purchase them at a nursery where there would be $150 to $200 or more. We give residents the information that they need to pick up their tree and plant it, and then they pick it up at our large distribution weekend. And then we partner with Tree Trust for all of our programs, and then they provide the actual full-service plantings for our free trees for green zones and low-income program, and then our commercial canopy program. So for those green zone residents, those trees are planted completely free of charge, and for any commercial sites, they are $30 each. For both of those, that does include a consultation with one of Tree Trust landscapers, and they work with the person to decide on which trees they're interested in and the best ones for their property. So here's where we're at with our 2025 numbers so far. These are trees that have actually been planted. I do want to acknowledge we are aware that our green zone and low-income property number and the commercial canopy number are a little bit lower. For the green zone program, we do have several of those sites planned already. We've removed trees at 172 addresses through our condemned tree assistance program, and so each of those 172 property owners will have replacement trees planted for them this fall. If requested and their yard allows, we can plant multiple trees for them. These programs do take more time because we're trying to reach people that don't know about our programs. And so our team has put a lot of time into being thoughtful about our approach and working to reduce barriers so that everyone can have access to these benefits that trees provide. We're also starting an engagement campaign on August 1st for both of these programs to recruit the remaining participants, and those plantings will happen this fall. One of the exciting things that we're working on is a social media campaign that will feature residents and their connections to trees. This is something that our tree outreach coordinator, Sed Muhammad, landed on by the relationships that he's built with the community over the last 8 months since he started. And, there's a lot of ways to market trees. They provide a lot of different benefits. But this idea of kind of planting a memory and sharing people's stories and personal connections with trees is not something that we've tried before. So we're really excited to share some of those really powerful quotes and photos with this new idea to capture people. We've also been working with an advertising agency to help with those social media campaigns and newsletter content, and they've also been developing some printed materials for us. Last summer, we did a series of community tree workshops. We hosted 5 in English, 5 in Spanish. This was with the Green Career Exploration team in the health department. They issued a survey to hear from people with what they were interested in learning more about with tree care. We got a wide range of responses, and so we offered things from tree planting workshops to pruning to fruit tree harvesting, and we heard a lot of great feedback from the participants through those. We also do have 4 contracts with local community organizations. That is Metro Blooms, Harrison Neighborhood Association, Birch Tree Care, and Resilient Cities and Communities. And so these organizations are doing a myriad of different programming, but they've been doing things like educational workshops on the benefits of trees and emerald ash borer. We just spoke with our partners at Metro Blooms a couple weeks ago. They are leading a series of black ash tree basket weaving workshops with an indigenous leader, and they have heard a lot of people that have been really pleased with those workshops. There's been a wait list for all of those, and people find it really meaningful, and they're happy to be able to create something beautiful from these trees that have been lost due to emerald ash borer. And then our community forester, Shaheen Khalili, has also been working with a panel of a focus group from Little Earth community, and they are doing some things like a forestry career exploration, including a tree climbing workshop coming up. One of our larger events was our Leaf and Learn Tree Care Festival. This was in response to Kari and Kabir hearing from residents at a city tree sale pickup how even though we have given them the information that they need, they were observing that people really wanted to engage even more about their trees. And so we hosted this event, and it included things like planting demonstrations. We had experts there to answer people's tree care questions that they had, and there was a lot of creative opportunities as well. So we had tree art, there was poetry, and we heard a lot of feedback from these participants that they were just so impressed with how engaged our partners were that were there. Sometimes you go to an event and people are tabling and they just have flyers at their table, but all of these partners planned such amazing interactive activities and made people feel really comfortable answering any questions that they have. We have been working on our private property tree preservation ordinance. The intention of this ordinance is to reduce trees lost during construction. This has been taking some time. We have been trying to be really thoughtful and make this a really practical ordinance that's easy to enforce. So at this point, we have concluded data review and some interviews. We did research on several other Minnesota cities' tree preservation ordinances, and we also spoke with the cities of Portland and the city of Atlanta to kind of learn from the mistakes that they've made, things that are working well, so we can take that into account with our own ordinance. I know some of you have expressed interest in being a part of the public engagement, so that is, we actually have our kickoff meeting to start planning for that tomorrow, so I can provide more of an update after that, so you can have that information and get that out to your constituents. And then after the public engagement, the next step will be recommendations. Finally, I have an update on our Condemned Tree Assistance Program. So the reason that we pursued this funding to help private property owners cover the cost of their condemned tree, a lot of times because of emerald ash borer, is because of advocacy from community members like Mitchell Hansen and Roxanne O'Brien, advocating for the need that people really needed help with the cost of these tree removals. So we have a $8 million grant from the U.S. Department of Agriculture Forest Service, and this is an income qualified program, so applicants must be at or below 80% of the adjusted median income or enrolled in a social service program. Once enrolled, we cover the entire cost of the tree removal, grinding the stump that has been left behind, and planting replacement trees. So this program, we just hit our 1 year mark. We had started accepting applications last year on July 1st. And so this has been a really successful program so far. We have enrolled 172 addresses. At those addresses, we've removed 215 trees. Often people have more than one tree that needs to be removed at a given site. And we will be planting at least one replacement tree at all of those addresses. And I do also really want to share these numbers of the cost. So the average cost of a tree removed through our program is $4,877. The most expensive and actually first tree removed through our program was over $33,000. So Kari Umanzur, who manages this program and works with the residents to get them enrolled and processes the applications, just hears from so many people how stressed they were when they got this notice that their tree needed to be condemned. They're sad about losing their tree, and then they're really stressed about the financial cost. And so we just hear from so many people that they are so grateful for this program and that they do not know what they would have done without it. One thing exciting to look forward to is our Fall City Tree Sale for residents opens on Friday. So that on August 1st, it will open for first-time participants, and then the following Friday, it will open up to everyone. And then that will be open until September 10th, and then our pickup weekend is at the end of September. So to close out, I just want to again say thank you so much to my amazing team. They have each made such incredible contributions to the City Trees program, and they are the reason that this work has happened. That concludes my presentation, and I'm happy to respond to any questions you may have.
Thank you so much for the presentation, Sydney. I'll first pass it to Council President Payne.
Thank you, Chair Chavez, and thank you for the presentation. I was just curious if you knew anything about any updates on the park board's goal of getting rid of, so a lot of the condemned trees, particularly in the boulevard, have a lot of stumps left over in the boulevard, and I know that they have a pretty substantive backlog to that, and I was just wondering if you knew anything about that backlog and how they're moving through it.
I really don't. Probably the last update I heard was a couple months ago at this point. I know they were working on trying to secure some more of that funding, but I don't have a more recent update. I'm sorry.
That's all right. Thank you.
And next up is Councilmember Rainville.
Thank you for the presentation. I'm wondering how many people attended those tree workshops. You did 10 of them?
Yes, that's a good question. I think it kind of varied, and we also had different community partners, like Huelas Latinas and the McKinley Neighborhood Association, and so most of them had space for about 15 participants because we want to still make it very hands-on. And so I think, probably average of about 15 participants at each of those events. The Leaf and Learn was definitely our largest event. We probably had almost 200 people attend that event.
Thank you.
Thank you. And let's see if we have anybody else. No, the only question I have, well, one, thank you so much to you and your team for all the work to help put trees up all over our city. Hoping that we'll get a news bite to make sure that we can share this opportunity that you just shared with us with our residents.
Yes, absolutely. Our communications team is working on that.
Perfect. Cool. Thank you. Well, I appreciate it, Sydney, and thank you to you and all the staff that are working hard on this.
Thank you.
All right, colleagues, seeing no further comments or questions, I'll direct the clerk to receive and file that update. Our next and final item is a receive and file related to early childhood education workforce development. I'll now invite Mark, the manager of the workforce development, to get us started. Welcome.
Good afternoon, Committee Chair Chavez and council members. Thank you. I'm waiting for my presentation to come up. I'm sure it will come just in a second, but I am here. I am the manager for workforce development in CPED. And I am talking about a new set of pathways that are coming through our division related to early childhood education. So just give me 1 second until it is up on the screen.
Do you need help loading your presentation? No one puts it up.
Oh.
You have, yeah.
I have to find it. It was. There it is. All right. Thank you. All right. So I want to do 3 things today, just to give you a sense of what we're trying to accomplish in CPED and in workforce development around early childhood education. The first one is to give you a context of what early childhood education career pathway is and why the city is making an investment in it currently. 2, I want to update currently funded projects in this space called ECE. And then I'm going to conclude with talks of what we're trying to do in 2026 around some efforts that are going to knit together community-based partners to do this work in a more unified way. So let me give that context to why we're doing this work. It's been estimated by the state of Minnesota that about 76% of families with children under 6 have a potential need for early childhood education programs in their local areas. Current demand, however, exceeds the number of educators. So not just the seats available, but just the number of educators out there to increase capacity. And that is becoming a major problem, and why it sits with workforce development is that the number one request in workforce development programs of job seekers is childcare. It is a major barrier to rejoining the workforce. And so we take that very seriously, and one of the spaces we believe we can make an impact is in the training of more professionals in the field. What we do see is that labor supply and demand imbalance is leading to programs closing, in fact, and that is troublesome, especially at a time when the demand is high. And it's estimated that about 26% of Minnesota young children live in areas that are severely lacking childcare. So we want to do something about that. We have seen a large decrease since COVID, losing about 26,000 of these professionals statewide, impacting the metro, no doubt. All right. So in continuing on that, this imbalance of supply-demand, coupled with the need of job seekers in our programs, is why we're making this investment, and I mentioned that. And I'll get to what we're investing in just a second. What I want to highlight is that early childhood education is a real career pathway that is well articulated. We know that there are challenges at the bottom end of the pay scale that we want to address, things like entry points and $16 an hour wages that just do not match the skill set needed to do this job. So oftentimes we'll look to our state partners and federal partners to help us in that, although we aren't getting much traction at the federal level, as you can imagine. Why I say it's a really important career pathway is that ECE, this early childhood education, has so many entry points, and that's so important to our low-income communities and to those who are job seekers looking to enter, whether it be in high school, whether it be in a 2-year program, whether it be through a community-based program. We think that there's a lot of opportunity there. So let me just really quickly articulate the pathway that we've laid out and that the state has, in fact, highlighted as well, which is we know that there are entry-level roles as classroom helpers, aides at center-based and school-based programs. Then somebody could move up through increased training to a certificate program in child care assistant, education assistant, and even things like a doula. And that's the space I want to highlight today. You can go on and work on a 2-year program in infant and toddler teacher training, preschool teacher, paraprofessionals in a school-based program. And at each point, we see increased wages, which then helps to alleviate some of those pain points early on in the pathway. And then, of course, you could go on in a bachelor's degree and advanced degree if somebody feels compelled to do so. So let me tell you about what we're funding to give a context to why what we're making these investments in. Currently, we have 2 programs running at the YWCA. They really spearheaded this work. First, we invested $50,000 in a very small pilot program a few years ago and extended that. And that was to support job seekers interested in the educational pathway earn that Child Development Associate credential. More recently, within the last 3 months, we've made a much larger investment, $490,000. This was made possible by an amendment to the budget that did bring $500,000 to the City of Minneapolis and Women in Training to expand this. And what we're doing differently with the YWCA in this pathway is not just looking to train new employees, but then to pull trained professionals back into the field, because we know that there's been so many people who have left the field since COVID. And the last one that is in contract review right now is with Lutheran Social Services and $137,000 to work on their career pathway for that same CDA credential. Project goals, I wanted to highlight those quickly because most of these projects are relatively new. What we're hoping to get out of, and already have seen success with the YWCA, is that we're going to see about 70 new trained or renewed CDA professionals out there. We have program supports that include support services, stipends where applicable to support learners, matching folks with internships, and job placement supports at the end. We've already seen out of the first cohort that they over-enrolled, there was high demand for it, and we're seeing internships and job placements. So we're pleased with those early results. And with Lutheran Social Services, we're looking at a project much smaller, but we're looking at 16 enrollees and doing many of the same pieces of that. We're seeing, again, good traction. We're seeing a higher than average wage. The 6 folks that have come out of the early cohorts are actually have broke $20 an hour at that wage. So that is about $3 more than we're seeing as the state average. Next steps, and I'll bring this to a close, is that we want to build this out to be a more robust pathway that really looks to collaborate with our stakeholders out there in the community, one being internal to the city, the Youth Coordinating Board, who have been excellent partners in this to help us navigate this space. They've been in it for a while. We work with the Minneapolis Public Schools and their CTE, that's their Career and Technical Programming, and we articulate that to our partners at Minneapolis Community Technical College, our community-based trainers and workforce development professionals, and what we're trying to do is really build out and connect those dots across all those institutions, so we're not just sort of doing this in isolation. We want to promote and connect existing funding opportunities outside the city of Minneapolis, so take what we're doing and make it additive to what already exists at the state level. We know that there are projects and grants out there for schools to apply to, but there's also opportunities within the state's Drive for 5 projects, which include education as one of those pathways you could invest in, so we want to see and look at that. And then finally, we want to look at how we can identify program gaps that do exist within those already existing structures, and then we can maximize our opportunities within workforce development, within CPED, to do more work for more people. So with that, I just wanted to provide an update to that money that has been invested, and I will close out at that. Thank you very much.
Thank you, Mark, for the presentation. So the YWCA1, that program already concluded, correct?
We've concluded the first phase,
Okay,
and then the additional resources is underway.
Perfect. And so does that mean that currently 70 newly trained or renewed CDI professionals, or is it between the two programs, or that would be the
That's the combined total is 70.
When phase 2 ends,
yep.
correct? Okay.
Yep.
Perfect. Okay. Cool. Well, one, thank you for the work that you and the department are doing for this program. I'm looking forward to, I think, at the next steps to learning more about what that could look like, and really impressed. So thanks so much for the work.
Thank you, Chair Chavez.
Any of my colleagues on queue? Cool. Well, thanks so much. We'll probably follow up with some questions, but we appreciate the work.
Thank you.
Seeing no further questions, I'll direct the clerk to receive and file that update. And colleagues, seeing no further business before us, I will declare this meeting adjourned.